I think you will all agree with me that that was an amazing analysis, and it's so thought-provoking. I think we'll all want to have a look at some of those graphs and maybe start to, I guess, plot where some of our friends and neighbours sit, unfortunately. Unless anyone has a particular question now to ask Mithun, does anyone have a question they really would love to ask? Otherwise, we'll move straight on and we'll hear now Professor Melissa Haswell, and then we can have question time after. Now, Professor Melissa Haswell may be the last speaker on this speaker program, but she is an esteemed epidemiologist. Her record of peer-reviewed articles is of the highest order, with very large numbers of peer reviews per article. She is an expert in the study of Aboriginal health, and she's also taken a very strong interest in the coal seam gas issue and published a paper. I recall my first paper of yours was in 2014 that I heard her present, and so since then she has been continuing her work in this field. I welcome now to the microphone Professor Melissa Haswell.
Thank you very much, Anna. Thank you so much for your energy and your enthusiasm in pulling this forum together today, and of course all the other people who have helped you out. It's wonderful to be in Narrabri again. It's also, I just want to thank the speakers who have spoken so far, because I think they've given you an incredibly crystallized view of the wide range of concerns we have regarding health, potential health impacts in relation to coal seam gas. And I'm a very strong fan of Dr. Mithun. I think that if you look, and as we've met, some of us have been looking at the peer-reviewed literature for quite a long time now, you will not see a paper like that on mental health. It has been largely ignored in most of the studies, or people just haven't been able to look at it with such a clear lens, such as we've just heard, where you bring in the existing burden and vulnerability of some of our most important, obviously our most important people in this country as far as providing us our basic need for food, and then looking at something on top of that. So in public health, we always need to be looking at the most vulnerable people in our community, and farmers are our most vital people in our community as well. So thank you very much for that presentation. And I'd just like to also thank the traditional custodians for welcoming us this morning. That was a wonderful welcome, both in song as well as in words. And I'd like to acknowledge all the traditional owners, the Kamilaroi people, and pay my respects also to elders past, present, and emerging. And my talk is a little bit, it's going to be quite different from the others. I'm not going to hit you with new information about coal seam gas per se, but I hope my mandate is to actually try and help pull together the arguments that we can make in terms of this industry and the approaches that we might be calling for to have the voices heard and the issues raised that we've all been sitting here listening to for a few hours now. And I come from, as Anna said, I come from a background, I've spent many years, I've been privileged to work with Aboriginal people for about 15 years now, and I never get tired of looking at this wonderful map which maps out the different clan groups and language groups of Aboriginal people around the country who learned how to live in harmony with their environments. And you cannot ask for more sustainability evidence than 65,000 years. So as we look around and we think about what's happened in the last 225 years, we should have a look at ourselves and how, whether we're listening carefully enough to Aboriginal and Torres Strait Islander Australians. So in this talk, I'll try to be quick because I know I'm the last one of a long day, but I just want to give an overview of approaches used in the various ways to assess possible predicted risks and impacts associated with the activities, compare the advantages and disadvantages of these, discuss the precautionary principle versus risk management, and hopefully open up a discussion about what a health impact assessment on CSG and Narrabri could look and feel like. So I'm probably what I'm trying to do is give you an idea of what's being done so that you can argue, perhaps in a language of what more could be done and should be done. And this is a complicated picture, which I won't go into now, but I hope by the end of my talk, it will look a little bit clearer in what it means, because I think it's a very important message in this particular issue. So these are two main pathways and tools in environmental health assessment, those things that are used to make decisions. And there's two clear pathways, one on the left-hand side in terms of risk-based assessment versus on the right-hand side looking at impact or potential impact and use in using knowledge and including the precautionary approach in decision making. So starting on the left-hand side of that diagram, just human health risk assessment. Now these terms aren't always used in the way that I'll be talking about them, but typically, human health risk assessment is a process of estimating the potential impact of chemical, biological, physical, or social agent on a specified human population under a specific set of conditions for a certain time frame. Okay, so it's almost like a mathematical equation where you plug in different numbers and you come up with a risk assessment result. So some of the underlying assumptions of health risk assessment, which is often used for this decision making, is that we can quantify human health environmental hazards and risks. We can actually put numbers to them. It's an underlying concept in most of the ways that this is looked at, and it's said to assist in making rational decisions for reducing risk and guiding allocation of resources. So that's how risk assessment is defined. So we've already, this is actually, if you think about the number of talks you've heard today, we've heard about issue identification, hazard assessment. So Shay talked about that hazard identity. What is the problem? What are we talking about here? So what chemicals, potential effects? How much might people be exposed to them, i.e. the dose response? How much exposure might people have to these things? And then characterizing the risk. So that kind of shows that process that's used in risk characterization. And I think what Shay pointed out beautifully is that risk management coming from that often doesn't happen using that information, or we have so many gaps that it's very difficult to manage risks without that. And a lot of environmental impact assessments, so that 700 pages that is produced for the development here, uses that approach. So there's advantages. Yes, it's based on epidemiology and toxicology. Yes, it uses numbers, which are often, because you have numbers, they're often taken more seriously than qualitative information. You can compare risks, and you can incorporate health risk assessment into other assessments. But the disadvantages are that it was not really developed to look at something as complex as what we're talking about today. It's individual toxins, it works quite well. In a workplace, it might work quite well, but in a diverse community with diverse challenges, it has its limitations. Limited by limited data, lack of definitive outcome because we don't really understand the outcomes of this industry yet. maybe scientifically weak, because if you don't know the answer, then you make assumptions. So you pull numbers from other places to plug into your assessment. And it doesn't really address issues of equity and justice, which we've heard a lot about today, which are also essential for good public health. And community values and voices are often not part of a risk assessment. It's often done by experts only, and it has no mechanism to include stories and qualitative information and what happens on the ground, as we've heard so much on today. And in terms of a lack of information, if we don't actually have the studies, if we don't really know these things, how can we understand what the risks are? So this graph is just showing, you've heard about this paper earlier today. It's just showing the very rapid rate of peer-reviewed publications, mostly on shale gas mining in the United States. But look, there was almost nothing in 2009, 10, 11, 12. But you could see these bars go up even further in the last couple of years. And if you'd like to have access to these papers, there is something called Roger. It's a database that's freely available, and it's basically a research library that you can go to, go into categories, and you can see a collection of peer-reviewed publications. So this is counting them, but you can actually have access to those papers themselves through the Roger database. I noticed a number of people took pictures of that. It's really an excellent resource. And I'm not really putting risk assessment down because it actually has a lot of valuable uses, et cetera. And there is some exciting work being done to try to enhance or to keep improving risk assessments for their use in situations such as where health might be impacted by environmental change. Another problem, though, with risk assessment, and when we're thinking about the complexity of a development that we've seen all afternoon here, is that fracking is only one part of the process that carries health concerns. And I'm particularly referring here to the NICNAS work, which was looking only at chemicals that might be used in not even the fracking process, but in the extraction process. And that is so small compared to the many, many risks and concerns that we heard about today. So that little diagram there, Helen Redmond showed initially, where we're talking about all those layers of environmental determinants of health. The fracking part is only one tiny part of all of that. Also, risk assessments don't often keep up with the vulnerabilities and the exposures that are changing in our world. So populations are changing. There's more people, there's an aging population. We're older as a population. Chronic diseases might be there. So there's an increasing vulnerability of our communities to hazards and risks that is very rarely captured in risk assessment. Populations are growing. We have resource restrictions such as water supplies, et cetera. Populations are moving. We have a lot of concentration of hazards in people in certain places. And socioeconomic and health inequalities are growing. So as we see farmers stressed by financial issues, that is actually a health stress as well. It's not just a socioeconomic. We saw, as Methuen showed us, it's also a mental health issue. And we rarely see that taken into consideration in risk assessment. Also, the climate is changing, temperatures are rising, the ways rainfall is hitting on us, whether it's in floods or droughts, means that toxins are moving differently than they used to. We have extreme situations, flooding, overflowing of holding ponds and things like that. The heat itself causes risks to our health, our heart. So if we've got underlying issues plus heat plus chemical exposures, for example, to PM 2.5, as we saw recently. And our environmental resilience is shrinking over time. So rarely do you see risk assessments taking any of those things into consideration. So when we think about complex problems such as what we have heard about today, we heard at the very beginning that health is not just the absence of disease, but the presence of physical, mental, and emotional well-being. And risk assessment doesn't cover those things very well. It's usually pretty good about potential diseases, but it says very little about mental and social and emotional well-being. So if we think more carefully about this, we need tools that can actually take those into consideration to help make decisions. And the peak body of environmental health practitioners and professionals in Australia have actually captured this in their environmental health strategy. New, so this wasn't here in previous environmental health strategies where the traditional activities we can actually deal with using old tools. However, when the nature of these stresses become more complex with climate change, more complex environmental health threats, we need different responses. And the nature of these threats implies that the response needs to be anticipatory. That means we should prevent before. We shouldn't let things happen and then try and respond. Integrated, so working together and requiring higher level determinants and indirect pathways to come into our thinking. Risk assessment doesn't do that very well. And we recently heard from, showing John Adgate's wonderful pictures, showing us the complexity of issues we've got here at the well site, in the local community, in the regional community, and in the globe. So we've heard about those hazards right across those levels today. And back in 2013, we mapped some of this. This is meant to overwhelm you because it's meant to wake you up at the end of the day. Because if you actually map, sort of in the middle, it says unconventional gas exploration and mining. What are those things that people are talking about or experiencing? And when this was first done, there wasn't very much peer-reviewed literature to actually back up these things. There's much more now, but there's still much more to be done. So there's sort of slices here that go from security of our climate, risks to air quality, water, catchments, etc. we've heard about today, our economic well-being we heard about today, agriculture and food supply we heard about today, our landscape, biodiversity, cultural and natural heritage. I don't need to tell you guys that, with the Pilliga Forest being the place of concern here. Safety, there's an awful lot of social changes which impact on communities. The security of our identity and global reputation, are we going to meet our Paris Agreement commitments or not? And well-being of our young people and families, which we just heard about in terms of farmers. So this is how complex this issue is. It often, when we hear it or you read a book, you see it in a linear fashion, but when you put it together, you go, well, even if one of those things is impacted negatively, it's not a good thing. So when people say, oh, it's not proven, or this or that, you say, okay, well, what about this? What about that? So this is sort of a synthesis or putting together of all of those things. And health impact assessment, I was talking about health risk assessment, but health impact assessment is a lot better at this than risk assessment in terms of putting together and synthesizing all of those issues. So the environmental health peak body in Australia has actually just published a brand new health impact assessment guidelines, which support their new strategy, saying that we need to use more comprehensive and holistic ways of looking at these complex issues, and that's available online. So what is health impact assessment? Well, it's a combination of procedures. It's not just quantitative numbers. It can actually use a whole range of procedures, including qualitative, quantitative, by which a policy, program, or project may be assessed for its potential and often unanticipated effects on the health of the population and the distribution of those impacts within the population. So that's quite different from what we heard in terms of the risk assessment trying to quantify only. And this slide was also shown earlier. If you think about all that we've heard about how the industry impacts on clean air, on water safety and security, on our food supply and our food producing workforce, our climate, meaningful livelihoods, and resilient and cohesive communities. Now, these environmental determinants of health are going to be even more important as we go into the future. This is just saying there are many, many needs that we need to be met through the environment, that if we don't look after these needs, we have a decline in things like mental health. We might damage the rich and wonderful diversity of cultures of our country. And people have spiritual needs in relation to the environment. We don't do well if we don't have nature around us. So how do we put those things into an equation, a mathematical equation? We can't do that. But we can use health impact assessment to tap into these more subtle but extremely important aspects of our lives. And UNSW has been a leader in the health impact assessment, and there's a web link there that you can read about the different ways they've been using HIAs in order to assess plans, projects, programs, policies, should be before they're implemented, predicting health impacts of proposals from a holistic point of view, and recommending changes to maximize positive impacts and minimize negative effects. And there's different types. There's mandated, there's decision support, advocacy, and community-led HIAs. And it's a process. So I think Geraldine told us about the fact that the Queensland Health Study just did the first one about screening, but there's a screening, scoping, identification, assessment, decision-making, and evaluation and follow-up steps in this process. And what is it trying to achieve? Informing, influencing decision-making during policy development or during decision-making, enhancing the positive impacts, reducing the negative impacts, reducing health inequalities. So when someone is gaining and someone's losing, that's actually bad for everyone's health. Health equality is a key point for a healthy community. Getting sectors together to make decisions, to discuss things, and provide, this very importantly, providing a mechanism for public participation and stakeholder engagement, which we didn't see in health risk assessment, and a framework for monitoring and measuring. So through a health impact assessment, communities or those who are doing them can actually identify what they want out of it and call for monitoring under the conditions that they want it to be seen as. So health impact assessment depends on how much resources and funding you have. Doing a comprehensive one, given the high levels of potential impact here, a high level of resources should actually be made available for a comprehensive health impact assessment. But to date, I think we've only seen in the little box called desk-based. So it is, depending on the level of HIA you have, needs to depend on the resources you have. But that doesn't just mean paid resources. And I gather in Narrabri, you have many people with many different expertises already here. So those resources don't necessarily have to come from external places. And this is another sort of diagram, quick diagram of what the procedure of HIA looks like. And I just wanted to, I won't try that laser printer, but I just wanted to say, see where it says stakeholder consultation coming down right there? That is supposed to happen in screening. scoping, appraisal, reporting, and monitoring. That means that the community, for an industry like CSG, the community should be engaged right at the very beginning and right through to the end. And once that health impact assessment is done, then it should go into an implementation process. There should be monitoring, evaluation, follow-up, and any new problems that arise should be taken into consideration, so there can be planning and responding to those issues that are raised. So basically, when you look at health impact assessment, you can look at broad, multiple interrelated issues, and you can use a broad definition of health, not just a narrow one, such as in risk assessment, and you can use qualitative and quantitative, people's stories as well as measures. And it's very sensitive to environmental justice perspectives around who's gaining, who's losing. If there are people who are losing, what are they experiencing? And looking at that in terms of how can we have win-win solutions? What's important, whether risks are felt evenly through the community, and democratic, is community having a voice. I'll just skip that one. So equity in terms of who is gaining and who is losing, when we think, I'll just have my last point here, is around both intergenerational equity, but also tomorrow. So we've heard a little bit about climate change so far, but remember that is the outer layer of environmental determinants, which impacts on everyone. So when we think about tomorrow's generations, we really do have to think about climate change impacts. You've heard a lot of terrific information so far. I'll just add one more piece of information to that, and this comes from the National Greenhouse Gas Inventory. So there are measures that industries have to provide to the government, and this is showing in terms of gas production itself. Over the years, we can see the increases that Geraldine told us about from the Darling Downs from 2013 and rising rapidly. So the rate of increase of gas production has just taken a big jump from the Queensland and the production almost all by itself. So already we can see a big impact on how much gas is being produced. And this is showing the fugitive emissions that have been reported. That's probably not counting all the ones that escaped in the night. But we can see from 2013, 14, 15, 16, and 17, now we're actually seeing much more fugitive emissions of methane coming over the last couple of years. And this distinguishes between the gas flaring, the venting, along with production, and it's going hand in hand. So if we are expanding this operation here in New South Wales, in the Northern Territory, in Western Australia, all these places are flirting with the industry, flirting with expansions. We can only expect that line to continue to go up as that happens. And as Helen showed you, massive impacts on human health. And one last point is about children and thinking about children in all of this, because all the things that have been talked about today, children are particularly vulnerable to air pollution, noise, the exhaust, not having places to play, distress, water security, and climate change. So children have the most to gain from our decisions and our commitment to win-win innovations today. Thank you.
Thank you very, very much.